Hello, everyone. I am so excited. I've got Karina Brown here for this episode of Plug into Devin. Karina is the candidate for lieutenant governor, along with Chris Peterson, who's the gubernatorial candidate. She is also a sitting planning commissioner for the city of Nibley, and she is president of the Cache County Friends of the Children's Justice Center Board. She is also one of the founding sponsors of Prop 3 for Medicaid expansion that passed a couple of years ago. She's extraordinary. You don't want to miss this episode. Karina, welcome to the show.
Well, thank you so much, Devin, for having me on the show and for that kind introduction.
Well, thank you. Golly, we're so excited to have you. Thanks for making time. What do you want to talk about, Karina?
Well, I'd like to get the good word out about Medicaid expansion because, as you know, the Utah voters passed it with the majority vote in 2018, but effective January 1st, individuals earning up to 138% of the poverty level became eligible for Medicaid. And so when we passed it in 2018, the legislature did some tweaks to it and tried to get some waivers passed through the federal government. But the full expansion that the voters requested went into effect on January 1st. So approximately 100,000 Utahns are eligible for Medicaid.
Wow. So how do they sign up?
Well, they can sign up by going to website healthpolicyproject.org. There's some links to be able to sign up from there, and the Utah Department of Health website. There is an organization called Take Care Utah that helps people enroll in Medicaid, and they have Spanish and Arabic translators there to assist people too if they need it. People can call 2-1 to get connected with Take Care Utah enrollment assisters, or go to takecareutah.org.
Great. So 211 was the number to dial, right?
Right.
Great. Well, Karina, I really appreciate you sharing that, but I want you to reflect back. You helped lead this effort. Why was it important to you personally to lead this effort?
Well, I became interested in healthcare advocacy because my mother passed away in the healthcare coverage gap in 2013. And when I saw what was happening in the state, I became interested in Governor Herbert's Healthy Utah plan in 2015, 2016, and that didn't pass, unfortunately. But becoming more involved in the community in the state, working with the Democratic Healthcare Caucus and other organizations like Utah Health Policy Project, I was invited to be one of the sponsors or signatories on Proposition 3, which is a great honor for me as a citizen who started out advocating because of my mother and realizing that this could help other people in similar situations. And so it's been a wonderful experience for me to work with other advocates in the state. Utah Health Policy Project has been wonderful. And of course, all the voters that voted for Proposition 3.
Well, you described briefly the healthcare gap. What were you referring to?
Well, the healthcare coverage gap, like for my mother, is that she didn't qualify for Medicare yet, and she didn't quite make enough money maybe to buy her own insurance in the situation that she was at, or maybe she didn't qualify for work insurance. And so it's a hard situation that people are in, especially for single adults. For the first time in Utah, really, single adults that don't have children living with them at home can be eligible for Medicaid, whereas prior to Proposition 3, they couldn't be eligible unless there was some kind of circumstance like disability or things like that. And so it's a very big step for Utah, and I think Utah voters have shown that we are compassionate and we want to help our neighbor. And so that's evidenced by the majority vote for Proposition 3.
Excellent. This is really important work. I really appreciate you leading that effort and taking the time to explain it to us. Karina, as you're now running to be Utah's lieutenant governor, what would you say is your superpower?
That's a good question. I think my superpower is being able to work with people that are different than I am and work on a common goal. and to kind of sense the vision of what we can accomplish together, and doing things to make that come to pass.
Oh, fantastic. Well, Karina, again, thank you so much for taking the time to be with us today. Before you go, remind people where they go to enroll in Medicaid and where they can go to learn more about your campaign.
Well, thank you. They can learn more about Medicaid at takecareutah.org, or more in depth about Medicaid and COVID-19 resources at healthpolicyproject.org. And you can learn more about our campaign at petersonforutah.org.
Excellent.
Or .com.
Lots of ORGs. So thank you very, very much, Karina. I really appreciate you taking the time to be with us today, and we wish you every success in your efforts to make sure that every Utahn has good health insurance.
Oh, thank you so much, Devin.
All righty. Let's be bold together.
I'm Devin Thorpe. For the last 8 years, I've been working full-time to eradicate extreme poverty, improve global health, and fight climate change. I've concluded that the best way for me to continue my work is to run for Congress to represent the people of Utah's 3rd District. In Utah, we have common shared values. Those things unite us. I believe passionately in our ability to come together, and I believe that working together, we can solve Utah's problems. I'm Devin Thorpe. I'm a Democrat. I'm running to represent the people of Utah's 3rd District.
I'm Devin Thorpe, a candidate for Congress, and I approve this message.